what challenges might present for a rheumatologist trying to use telemedicine?
Well, that's an excellent question, and it's a one that I think a lot of providers who are new to the field are asking themselves. I mean, certainly the primary concern that they have, and everyone has, is the lack of a physical exam. Um, Physical exam plays a big role in rheumatology, and it's a very difficult sort of um, transition for providers to care for patients without a physical exam. There are substantial and significant workarounds for that, but they require some ingenuity on the part of the provider. So, for example, I often have patients show me how they walk, show me how they actually use their upper extremities for activities, and I can do some physical exam maneuvers that are identical to what they would be in person, but they have to use, the visual rather than the sensory input from the exam. Sometimes I have another individual on the patient end do some maneuvers with the patients, and I think a lot of rheumatologists will be familiar with the fact that you can elicit tender points with a non-trained individual if you instruct them where to press and how hard to press. But other aspects of it have been codified in a recent article published in the Mayo Clinic Proceedings called Telemedicine Musculoskeletal Exam. That was in August of this year. So just recently, last couple of weeks, there was a nice summary article of all the ways that you can replicate a physical exam through a video connection. And I think that's very useful. That's the major concern. There are other concerns. There are patients that are not particularly well suited to a virtual appointment. They either have a hearing or a visual impairment. They may have less cognitive ability than it's required to conduct that kind of interview. And those would be the major things. Sometimes their diseases are just simply too complex, and there are too many comorbidities. The disease itself may be very complicated. A very sick lupus patient, for example, somebody with a form of vasculitis that you just don't feel comfortable with on a video encounter, and I respect that. And those individuals have to be seen in person. And lastly, I think it's very important that the patient buy into the virtual encounter. If patients say, I don't want it, and I have this all the time, then I have to provide them an in-person evaluation. And this spans socioeconomic, gender, and age ranges. So you can't predict. If a patient is uncomfortable, you have to give them the opportunity for an in-person evaluation.